Hello, my name is Nicholas Scalercio. Today I'm going to be doing my Module 8 video presentation assignment on clinical anatomy. Here is my little flashcard with the topics that I'm going to cover. Okay, so let's go ahead and let's start. I really enjoyed Module 4, the anatomy of the skeletal system. I've always been fascinated with the bones of the body and how they work, how they break, and how they heal. Like I mentioned in my Module 4 video assignment, bones are responsible for the structural support of the body and all of its organ systems, protection for all our delicate internal organs, mineral storage for minerals such as calcium salts, red blood cell, white cell, and platelet production, leverage and attachment sites for the muscles and other organ structures. Osteology, which is derived from the Greek word osteon, meaning bone, is the scientific study of bones. An osteologist is a scientist that studies bones. Orthopedic surgeons are devoted to the prevention, diagnosis, and treatment of disorders of the bones, tendons, muscles, and ligaments. Some orthopedists are generalists, while others are specialized in certain areas of the body, such as the hip and the knee, the foot and ankle, shoulder and elbow, hands, and the spine. Orthopedic surgeons usually explore non-surgical options first when treating patients, such as pain medications or rehabilitation such as physical therapy, like what I do. They also have the expertise to do surgeries to correct injuries or malformations, if necessary. Orthopedic oncologists are specialized in the diagnosis and treatment of patients with bone cancers. Okay, now here I have my skeleton. One example of a bone that I like is the scapula, or shoulder blade. The scapula lies on the posterior side of the body. It is lateral from the spinal column. It is medial from the head of the humerus. As you can see, the scapula is irregularly shaped with these ridges and curves. However, it is actually classified as a flat bone. Some bony landmarks I want to point out on the posterior side of the scapula, the back side, are the medial border. This is the border close to the spine. The lateral border. The superior border. The spine of the scapula. The acromion process. The supraspinous fossa that is located superior to the scapular spine. The infraspinous fossa that is located inferior to the scapular spine. And lastly, the superior, inferior, and lateral angles. The scapula is important as an support and attachment site for many muscles, tendons, and ligaments. It also allows the upper extremity the ability to move in pretty much all directional planes due to its location and from the attachment sites for the muscles that are attached to the scapula and also to the arm. And that concludes my Chapter 8 presentation. Thank you very much.